Today's episode is an interview with Dr. Wendy Stephan, an educator and epidemiologist for the Florida Poison Information Center in Miami. As a poison prevention advocate and educator, she shares important messages through storytelling. You're listening to the Pharmacist's Voice podcast, a journey-style podcast about my career change from pharmacist to voice actor. I'm your host, Kim Newlove. I alternate solo shows and interview shows. The solo shows are about my career change, and the interview shows feature a variety of people who use their voices to advocate, educate, or entertain. I specialize in medical narration and e-learning. If you have a project in mind, contact me through my website, thepharmacistvoice.com. That's thepharmacist with an S, voice.com. Thank you for joining me for episode 27. Before we get started, I need to make a brief announcement. Listener discretion is advised. Some of the topics we'll discuss include kids putting weird things in their mouths, poisoning, injury, death, medicine that looks like candy, and more. Again, listener discretion is advised. Thank you. My guest today is Dr. Wendy Stephan. Let me tell you a little more about her, then we'll dive right into the interview. Dr. Wendy Stephan is the educator and epidemiologist for the Florida Poison Information Center in Miami. For the past 12 years, Wendy has promoted the use of poison control and worked to prevent poisonings of all kinds, including from medication, household chemicals, and environmental hazards. Wendy completed her PhD in epidemiology and her Master of Public Health degree at the University of Miami and has previously chaired the Public Education Committee of the American Association of Poison Control Centers. Without further ado, here's my interview with Dr. Wendy Stephan. Good morning, Dr. Wendy Stephan. Welcome to the Pharmacist's Voice podcast. How are you?
I'm good. Glad to be with you.
Where do you work and what's your role there?
So I work at the Poison Control Center that serves South Florida. Our technical name is the Florida Poison Information Center in Miami. We partner with two other poison centers to serve the state of Florida. So we've got sister centers in Jacksonville and Tampa. And then we work with the other educators and poison specialists to make sure that everywhere in the state, and even actually in the Virgin Islands, they have poison control center services.
Oh, that's amazing. I didn't know about the islands.
Yeah, the Jacksonville Center has that relationship.
So you cover Puerto Rico also then?
Puerto Rico has its own poison center. So there are 55 poison control centers around the United States, and every state and territory has service through a poison control center. And so, even Guam and, some of our more distant territories have services that they've contracted with different poison centers. So it is a national service, which is one of its tremendous strengths. So we do our little part down here in South Florida.
Well, thank you for the important work you do. I invited you on the show because you use your voice to either advocate, educate, or entertain. Can you tell me which one or ones apply to you in your role there at the Florida Poison Information Center?
Sure. So initially, my thinking was that I would be educating, right? So just, very direct, and I love to teach, et cetera. And I have all these amazing facts. And I'm a geek with poison, so I have all sorts of historical facts and data because I'm an epidemiologist. So I'm came in with kind of the sense that I would be just providing people with a lot of data, sort of the fire hose, approach. But what I found was that actually the way to get people's attention and hold it and actually create a connection with the material was through entertainment. And so what I've really become in the work I do is a storyteller, in essence. The Poison Control Center provides a tremendous stream every day of stories. And, people facing a moment of crisis, and some can turn out to be funny, others terrifying, some tragic, but all informative. And the story allows people, I think, to connect in a way that the facts don't necessarily. So I back it up with facts, but I do a lot of sort of case-based information and really in the form of a story.
That can be a very effective way to reach people. Very visual very impactful and meaningful on a personal level. Good for you.
Yeah, I think we're just we're programmed to learn from stories back, throughout human history, and I also tell stories about myself and my family because I think one of the dangers with injury prevention generally is kind of you know I'm telling you what to do and don't do this and don't do that, kind of like a just say no type, approach, which shuts people down, I think, in general. And so when I tell stories about our own mistakes and our own experiences, and that we've done this, like even with the best of intention and all the facts and all the knowledge, I think it allows people to imagine that it could happen to them. And it just makes people more open to considering that they may also need help or they may need to take some preventive steps.
What would you say to pharmacists? What could pharmacists do to prevent poisonings and make an impact in their own communities?
Oh, well, pharmacists have a huge role to play just because medication poisoning is now such a tremendous part of the problem that we're seeing across different ages. We have pharmacy students who do rotations here, both from the University of Florida and from Nova Southeastern University. So I've had the pleasure of working with pharmacies, students sort of pre-service, and they're with us for about a month. So we really get to know them, and I've been taking them out into the community with me, and they enjoy it so much. So it really, you get to see kind of sort of that face-to-face interaction where you're providing guidance. And I think of all of the different students I work with in the community, the pharmacy students have been most consistently enthusiastic because it's a role they don't get to play much, so they're often behind a counter or, working with their substances, et cetera. But to get to be face-to-face with the public, whether it's children in a school setting or, parents in a public setting or even older adults, they've been wonderful partners. So they get to enjoy that aspect of it, sort of promoting the Poison Center.
That's wonderful. And then when they graduate and go out into their various practice settings, no matter where they practice, whether it's retail or hospital or a nursing home setting, I feel like they can still go out into the community and position themselves to say, hey, I can be at a health fair or I can visit an elementary school, especially in March. Why is March important?
So the third week of March, since more than 50 years actually, is National Poison Prevention Week. And that is a time when often it is pharmacists or independent pharmacies that will, contact us ahead of time and say, we'd like to promote the poison control that week. It's not that you can only do it in March, but that's definitely been part of it. And I started pulling in our rotators into my trainings in-house that I provide for safety educators and sort of giving context for poisonings. When I encountered one of our former students, in a retail setting, and I was like, hey, kind of jokingly, so do you know the Poison Control Center number? Like, haha, and they didn't.
Oh, no.
And I was like, that I dropped the ball. I need to be including our rotators in that outreach education piece because no one is better positioned to do that work of reminding the public that that resource is there for them. And so we've been doing that ever since and trying to create advocates for the Poison Center, but also professionally. So one of the things that I tell our pharmacy students who are training with us is, if someone approaches you in a retail setting, so for instance, a police officer who wants a pill ID, right? That is something that they can hand off to poison control. That call is recorded, available under subpoena, and it takes the pressure and the liability off that pharmacist. That is not something that they want to be doing, at 2 a.m, with whatever resources are available to them, and it's going to be used in a prosecution potentially. So just hand that off to your poison control center. They can do that pill ID. They can assess whether it's abusable or all those things, and those lines are recorded, and it's just protection. So there are these, in addition to being a great thing for the community, knowing about poison control is important for their clinical work.
Now, since you brought up the phone number, let's hear it.
Oh, sure. So the poison control number around the country is the same. It is a national number as of 2002. So it is 1-800-222-1222. Be very careful to dial it correctly because if you misdial anyway, it is a sex hotline.
Oh, no.
So, yes, not what you need in a crisis.
No, not at all.
Exactly. So that's 1-800-222-1222.
Very good. When I work at health fairs and I'm working the medication safety table, poisoning prevention table, one of the first things I do, it's like an icebreaker. I try to hand people a pamphlet and say, "Do you have this number in your phone yet?" And they'll say,
Yeah.
"What is that?" And then when
Yeah.
they find out it's the poison helpline, I'll say, "Yeah, you put it in your phone. You can tack it
Yeah.
to the fridge anytime you have a babysitter come over. For peace of mind, just say, 'Hey, do you mind putting this in your phone?'" There's all kinds of great things you can do just having that number. It's an icebreaker. It saves lives. You can put it right in your phone. And when I work at elementary schools, one of the things I like to talk to fifth graders about is I'll say, "All right, who's got a phone?" And they don't want to do it, but they'll say, "Oh yeah, I've got it." And their teacher always kind of looks like a little embarrassed, but I'll say, "I'm going to give you a reason to get on your phone right now. I want you to program this number in your phone." So you're absolutely right. That number could save a life, whether you're a fifth grader and you're home alone or watching a sibling, or if you're, a pharmacy student or a pharmacist working at the counter, it can save a life. Definitely program that in your phone today.
It,
Yes.
Absolutely. And it's funny because even though school age children, for instance, are statistically very unlikely to be poisoned themselves, they're actually one of the safest groups population wise. What they are tremendous at is watching out for family members. They want to be of help. And so what we see is when I'm out in the schools, I'll say, "How many of you have little brothers and sisters?" All the hands fly up. "How many of you watch out? How many of your little brothers and sisters eat weird things?" And all the hands go up, and then they want to tell the stories of all,
I
the
love
sibling
that.
that ate the kitty litter and, all these funny stories, but it engages them. And you can see that they see themselves in that caretaking role. And I do also tell them, listen, if your mom or dad makes a mistake with a medicine or your grandma, remind them that we're here to help. And so teaching children asking behavior is actually a tried and true means of health education. So you kind of have like an inside man in that family then who you've trained.
Yes.
And that child can then remind the parent, what about poison control? So, and of course, if they have it in their phone, that's even better.
Absolutely. I love this topic because an ounce of prevention can truly be worth a pound of cure. And these simple things, and what you're talking about using a story, asking a kid a question like, have your brothers and sisters eaten anything weird? You're right. Everybody wants to raise their hand and share. And that's wonderful because you get the conversation going and they don't realize they're learning. It's
Yeah.
awesome.
Yeah, and you're involving the kids because I feel like it's quite remarkable when I go into the schools and I get really good feedback from teachers. If you can use the simple language and engage through stories and validate children's concerns and questions, they will bring forth all sorts of stuff, sometimes alarming stuff, but
Yes.
always interesting stuff. And so even at a classroom of third graders, they have all the answers collectively. So I'll say, what can you do to prevent poisonings? And in the class, every kid, there'll be a child that has all the ideas, and so it's very interactive and fun. And it's just great to be able to say to a kid, what a great idea. What a great question. You really have thought about this. And I'm sure you take great care of your siblings or your family, or you're going to be a great mom someday. Wow. It's fun to talk about with kids.
That's awesome. I'm so happy you've had such success all the way down to third grade. That's wonderful. What ages do you work with? What's the whole age range?
Well, technically, as a poison education provider, I mean, I am charged with everyone. So, but we know in terms of effectiveness that working with small children, doing direct to, say, toddler education, there is no evidence that that is effective. And there are some small studies that actually indicate potential harm when you do work in that population. So while your little ones, your toddlers, your 3, 4, 5s, their children obviously at risk themselves for poisoning because of their exploratory behavior and their development stage. Speaking to them about poisoning can actually give kids ideas. Mm-hmm. And so that is something I've talked to educators and parents, people want to go talk to the group because they're the at-risk group. But what we found is more effective is actually working with caregivers and those older children who have the skills and the experience to be more conservative and to not just be like, oh, you're right. Juice really does look like those cleaners, and I wonder what that thing tastes like. And, they don't have the judgment, the toddlers do not have the judgment to avoid, the pills and tablets that we've just shown them look just like candy.
You bring
So
it.
yeah, I work with the whole population, whole age.
Well, that's wonderful. And I have a son with a developmental disability. He's 17, but he
Ah,
operates more at the level of a toddler. And like you were talking about, he thinks some things look like juice, or he thinks
sure.
medicine looks like candy. And even though he's looks adult aged, educating the caregivers, I know that's myself, but I have caregivers that come into my home. Educating them that he eats non-food items is really important. So thank you for bringing that up. No matter what age, you have to think about safety.
And I think people tend to think about children with poison prevention, which makes sense. That's actually our historic sort of where we got started was, 50 years ago or more, where poison control centers got started. It had to do with small children and aspirin, really, preventing, those poisonings because they were rampant and, and terrifying. And, aspirin is crunchy and slightly sweet. So there was a huge problem. And that was how we got to, child resistant packaging, et cetera. So we've had a tremendous success over the years preventing poisonings in children, but that has basically unmasked a lot of poisonings in other groups. So you mentioned, people with developmental disabilities. So autism, for instance, families deal with sort of eating of the non-food behavior for many more years than a family, with a developmentally typical child. So we have also older adults, for instance, who also need help. So if you like working with that population, if you enjoy working with older adults, or that's your population you're working with, that is another group that really does not know about poison control. Once they learn about us, I have to tell you, they love us because they can pick up a phone and talk to a sympathetic person and who can walk them through what to do with that medication mistake, et cetera. And of course, they're more likely to make those mistakes because of poor vision, right? Low lighting in a home, multiple medications, all the things that, lead to medicine mistakes that I know pharmacists are experts in. So
You just identified a great population for pharmacists to try to help or just offer their expertise to. Talking to an area office on aging could be a great place to start. Just thinking out
yes.
loud here. Yes.
No, that's absolutely true. There are a lot of advocates and educational organizations, as well as actual facilities. So we go out through our elder affairs. We go out to facilities and talk to people, sort of lunch and learns, and those are fun. They're also social. They'll also tell great stories and be interested in our stories. And I do think, again, with our older population, how important it is not to sort of lecture or, say, don't do this, because people can feel stigmatized. What do you think? I'm old, that I'm taking a lot of medicine. People always love to tell me, older adults, they'll tell me, I'm not taking any medicine.
They're always proud
like,
when they have that
that's awesome.
to say.
That's awesome. I say, well, that's the very safest thing, right? To not take them. So, I always try to say, this is something that happens to everyone. This is not something that only happens to older people, or children. This happens to grownups like me. And then I tell my stories.
Let's talk about how you got started working there. Your bio said that you've been working right where you are at for about 12 years. How did you get started working there? And when did you realize you had a passion for poisoning prevention?
Well, it's funny because when I was 6, we were living in Washington State, and my little sister came home from Swedish hospital, and my parents brought with them Mr. Yuck stickers. And I remember where I was standing when I saw Mr. Yuck for the first time. I was in the kitchen, and they were explaining to me, like, we're going to put these stickers on so that the baby knows not to eat these things. And I just remember visually, the image, but also just the concept that there are poisons in our house. Like, that was interesting to me. Recently, I just went through a box of my things from middle school and actually found a skull and crossbones sticker. So it's funny. It's like, it was meant to be. But in terms of how I came to my specific role, I was doing some work on an environmental health curriculum for the National Institute of Environmental Health Sciences, called Ambient. When my children were small, I was working on that grant. It was wonderful, and I got to work with some colleagues in marine toxins, particularly Laura Fleming, who's very well known in occupational health and marine toxins. And she was partnering with the Poison Control Center, and they said, "Oh, we need an educator," and I was like, "Pick me, pick me." So it's been a nice fit for us.
Wonderful. I'm glad that you found something that was a good fit for you and that you have a passion for.
Yeah, it's a luxury. I mean, I've continued working, during the pandemic, and but it's been, this is, someone would describe this as like the Super Bowl, you're for epidemiologists. This is a once in a lifetime experience to be working in the field, and surprisingly, there has been a connection between the COVID-19 epidemic and poison control in a surprising way. So I've been really happy to be able to be of service during this time.
Oh, you've got to get into that. I would love to hear the connection between poison control and the COVID pandemic.
Yeah, so initially I didn't think there would be much. My background is not in infectious disease. So I, had to really literally brush off my old texts and, remind me what is R naught, what are these things that really I don't use in injury epidemiology very much. So I didn't necessarily think there would be a big overlap, but initially, right from the beginning, even before the lockdowns, we did start to see spikes in calls on certain substances. So the very first we saw was hand sanitizer. So as you know, hand sanitizer is it's a very high concentration of ethanol, so more than 70% typically. And so right from the beginning, we saw, tracking even before March, but through even February, we saw an increase. And so in terms of hand sanitizer, year over year, compared to last year, during the period March through middle of May, we saw nearly doubling of our calls about hand sanitizer. So people were taking the recommendations quite seriously, which was great. So they're using the product. That was the good news. The bad news is it was very available, and it was available to children. And then, people were getting it in their eyes. The children were licking the hands. They were squirting it into the sibling's mouth, every weird story. So the availability led to exposures. And so we saw that fairly early. And then following hand sanitizers, we saw right away then cleaning products. So people were, early on very concerned about the spread of COVID-19 or the coronavirus through surfaces. So that was initially thought to be a really important, source of contamination and exposure. Recently, we've seen that sort of minimized in terms of the sense of how it's spreading. But so we did see a huge increase. And so we saw, again, through that same time period, sort of March through May, disinfectant exposures up 143%, bleach exposures up 51%, household cleaning products as a class, 42% increase year over year. So our poison specialists were very busy. That being said, poison control centers around the country were also basically drafted by local health departments and public health agencies to set up separate hotlines for COVID-19. So in Florida, we were engaged by the Florida Department of Health to assist with the COVID-19 hotline. So we were provided very quickly with training and resources to manage a hotline. And actually today, we pass a milestone for Florida poison centers. We will have taken our 50,000th call for the COVID hotline. So, wow, we had to ramp up fast. And at the beginning, obviously, we had few answers. We were able to provide certain information, but not, of course, everything we would have liked to have offered.
Well, thank you for the important work that you do. I think a lot of people are scared, and thank goodness they have someone to turn to, someone with evidence-based data and information. That's wonderful.
Well, where there was information. I mean, that was the frustrating thing is, we were using data at that time at the beginning out of China, and some of that has held true, that has been valuable, and others, we've adapted as we've gone, as we've learned, which is important. And then we've had more resources, made available to us by the state Department of Health. They're, trying to evolve and provide options and testing resources for people as we've gone. But it was, quite a challenge. From the pharmacy side, I did want to mention poison control centers also saw big increases in calls about supplements and vitamins as people tried to prevent COVID infection. So pretty marked. So doubling, well, actually 264% increase in vitamin C calls. So that hadn't been really a big, a common call to poison control, but we were getting quite a few more. So not a ton, but still a lot more than we expected. And then just in general, 63% increase in calls about vitamins and 33% increase in dietary supplements and homeopathic remedies. So something to keep in mind during this period for pharmacists is that people are doing a lot of, do-it-yourself healthcare and trying to, use whatever information from whatever source about prevention. So you may need to ask more commonly, are you taking supplements or are you megadosing particularly? Because it may interfere with that medication.
Right. Asking how somebody's using their dietary supplements could be a very helpful question, especially with preventing a poisoning. The information that you shared, is that actually from Florida or is that nationwide?
Well, we saw the trend nationwide. So CDC reported on that in their Morbidity and Mortality Weekly report early on. So they actually talked about national data, but we had already published quite a bit of Florida data. So the data I gave you was for the state of Florida. So we saw it pretty early and we're posting on it on our Facebook page and just please, letting people know, caution with hand sanitizers, don't overdo it with supplements, getting that message out through social media because we were able to do that quickly and, inexpensively.
Dr. Stephan, with whom do you work directly? Do you train the poison call center professionals or do you man the lines yourself or both or additional tasks?
So I work closely with our poison specialists. So the doctors, nurses, and pharmacists who answer calls to poison control centers are called SPIs or C-SPIs. Their certification is a Certified Specialist in Poison Information. So if you ever see C-SPI as a credential, that is what they do. That person works at a poison control center. At our center, our staff is entirely physicians. So I do work pretty closely with our doctors on the phones, mostly because I'm, checking on them. I'm letting them know what I'm hearing from the community in terms of, have you been seeing this? I heard that, like the cinnamon challenge, for instance. I actually learned that from a school nurse, before we started seeing it on the hotline. So I bring to them what I'm hearing in the community or what I've seen in the media. I let them know kind of what they should be expecting. We're hearing this, or I'm noticing this trend, or there's been, a public health bulletin that they should be aware of to sort of brush up on certain things. So for instance, when red tide is starting in Florida, when we're starting to see the beginning of a bloom, which is a harmful algal bloom that has respiratory and gastrointestinal effects, I will go to them and say, listen, we're looking like we're starting a bloom in Collier County, so that they can brush up on their resources and remind themselves, if they haven't, been taking calls on red tide, sort of what that might look like and what resources are available. And in terms of training, I train mostly safety educators in the community. So that's my goal. Is I love to talk to our home visitors, for instance, through the Healthy Start programs who are working with parents. That is just gold for me. So because I know if I train a home visitor, I am reaching so many families. I also love to train foster parents and medical foster parents. Again, that's efficient for me. Instead of reaching parent by parent, I can reach the people who support parents. And it's also part of their paid work. I think it is difficult to expect people to do this important work entirely on a volunteer basis. I'm always glad when people have that time and that passion to do it. But I also think it should be part of people's paid work because it is life-saving, like you said. So those are the people I tried to train on a daily basis. And then we also do, I work with my colleagues around the state. We design the other educators. So we work together to design materials, flyers, social media again, so that we're getting that information out on a daily basis in all the different formats.
Well, that's great you're getting it out. How do you get people to actually pay attention to it? I know that's like the question, right? Because you're putting out great stuff, but how do you get people to listen? How do you get people to consume that?
Yeah. So like I said, reaching out to people like basically who are already being paid to do this work and helping them do that work better has been key. Because it's very difficult to compete with all the other things. Like you said, you're competing for eyeballs. So we really try to be relevant. So we work closely with the media. So when there's a media story out there, we are providing information, data, background, the resource for the Poison Control Center, just reminding people we're here. If you have questions about this new scary thing you're hearing about, or you want facts, we can provide those to you. So we've been doing a lot during the pandemic in terms of, the different treatments that have been offered, for COVID, and it's at such an early stage. And some of these, treatments have well-known risk factors and contraindications. And so we've been trying to be out there on that. But yeah, so relevance, trying to be really, really on top of it and responsive to news. We do notice that when we post about something that's been in the media or that has to do with a recall or something that really touches people individually, like, do I have that ground beef in my freezer right now? We have their attention. And then just talking about children in general, people are very keen to protect their children. And so that's really an important resource, always parent education.
Two things I saw on your website. Florida's got a great Poison Information Center website. Two things I noticed right away were snakes and aquatic toxins. I live in Ohio. Those are two things we don't have to worry too much about. What I see is you have an opportunity to reach people at different points, maybe at the beach or the tourism department. I'm not sure if these are things, maybe the Boy Scouts, Girl Scouts of America.
Yes.
Do you reach those people because they do have children from different age groups? I'd love to hear about that.
Yeah, so exactly. So it's funny you mentioned snakes, because when I go out into the community, the thing that people want to talk to me about are snakes. They're like so scared. And it's so funny because, our logo is actually a medicine bottle, right? On the Poison Help logo, there's a medicine bottle, not a snake. But what captures people's imagination are those venomous animals, particularly snakes. It's very visceral, and I get it. So people really have a lot of questions about snakes. They're very fearful about snakes. And so it's funny, that's when I go to schools, actually, that's often how I'll begin with kids, is like, tell me about things that poison, and immediately they want to talk about snakes. And then slowly by the end, I'll work them around to the things that are most likely to poison them in their home, which is actually going to be medicines. But it's a great way to kind of engage people, capture imagination. And we do get calls about snakes. We have about 6 venomous snake bites a month that we do handle. We get calls about, usually from a hospital, sometimes from, the site of the bite. Now people with the cell phones, it's very helpful. They're on scene. They can actually send us images. So it is not unusual that I get the snake in the bucket picture, where someone wears pieces of snake. Ugh.
Oh, dear.
So our specialists are able to look at the snake in many cases, or images of the snake with the treating physician in the ED setting to identify the snake, because that's going to be critical. If it is a non-venomous species, which is actually more common in Florida, we have more non-venomous snakes than venomous snakes, then that obviously simplifies treatment substantially. And then we do walk people through the use of anti-venom. And because people are so fearful, they want to know what to do. Like if there are snake bites, do I suck out the venom? Do we, what do I do with do we ice the limb, et cetera? So there's actually a lot of bad information out there. And so some of what we're doing is telling people what not to do. And then on marine toxins, you mentioned marine toxins. So one of the things that actually before I came to the Poison Center, I was working with Department of Health, and my colleague, again, Dr. Fleming, was on Ciguatera, which is a marine toxin disease that comes from reef fish. So people who eat grouper, red snapper, barracuda, hogfish, these fish can carry this marine toxin disease, which is quite serious. It is a neurotoxin. So if they get enough from one of these larger fish, they can have all sorts of unusual symptoms. And so even in Ohio, we see these cases. And so it's that the fish has been, transported and sold. And because it is inland, because you're not near the coast, near a reef, doctors have limited familiarity. And so they may not think to ask the patient, have you eaten fish recently? Because they're coming in with these really unusual neurological symptoms, so paresthesias. So hot things feel cold. You'll see tingling, achy teeth, joints, gastrointestinal issues, all sorts of unusual symptoms that go together to create a clinical picture of Ciguatera. And so that is just one marine toxin disease, which it sounds like it should be our problem down here. And certainly we do see these cases, but now that it can be seen all around the country. So there was a Ciguatera outbreak in New York City, for instance, and it came from fish that had been, shipped for consumption.
I was thinking more along the lines of, trying to think, not stingrays, but what's something else?
Oh, jellyfish.
Jellyfish, yes.
Jellyfish.
I was thinking about jellyfish.
Yeah, so we do get calls from the beach for jellyfish stings, and we see those in the spring and then all the way through, the swimming season. And our most painful jellyfish here now remains the Portuguese man-o-war. But with our changing temperatures, we are now seeing also, though, a type of box jellyfish here in Florida. And that's, one of these things that, these things do change over time. And I think that's been interesting to learn. We were contacted by a contractor from the Navy who was studying, for their divers, particularly, that they had several confirmed cases of these more venomous creatures. The stings were pretty serious, incapacitating even. So it's something we watch over time. But yes, jellyfish stings can be quite serious, and people can go into shock, for instance, if there's been, stings over a considerable part of the body.
How does someone know if they should call 911 versus the poison helpline?
Well, great. That is one of the things we teach, because we want people to know which resource to draw on, right? So if anyone is having trouble breathing, for instance, if someone is already unconscious and you can't wake them, if they're having chest pain, if there's a lot of bleeding, for instance, all of those things, not typical for poisonings initially, right? But you want to call 911 immediately. If there is a poison aspect, if the problem is thought to be poison, the emergency medical technicians, the paramedics, the crew will actually call poison control, and we can begin treatment on the vehicle. So they generally will engage us. But if you're seeing any of those extreme symptoms, then you can go straight to 911, and 911 will dispatch, and then the paramedics will work with us as needed. Now, most poisonings don't present like that. Most poisonings present like someone swallowed something unusual, it's unpleasant, it tastes bad, or with a medicine mistake, it can present as nothing. Like there's no symptoms. You can swallow the wrong tablet, a child swallows a blood pressure pill, the child swallows that extended release, medicine for diabetes, etc. The child seems fine. Right. So this is the most dangerous scenario, where if someone is looking for something dramatic, to know that there's a poisoning, they will miss it. And so what we're telling people is, anytime something unusual is swallowed, gotten in the eyes, gotten on the skin, something strange and out of place, even if there's not a serious symptom, we'd like people to call poison control immediately, so that we can just quickly walk you through potential problems, what symptoms you might look for, like developing over time. One of my poisonings for my children that I had to call about before I was working at the Poison Center was, my child got into toothpaste. She was a toothpaste eater. ate the whole tube of the guest's toothpaste. They had left
Oh
it
boy.
available. And so one of the things we were able to do right away was to give the child, some, in this case, it was milk, which is unusual because milk actually isn't much of an antidote. But for fluoride, it actually does bind with the fluoride. And the poison specialist told me, she may throw up in the next hour and it may look like cottage cheese. And she says, that's good. That's what we want, because that'll mean you blocked absorption and we don't have to worry about it. So, even if that poisoning was not a life-threatening, scary thing, it was very good to have the information I needed to sort of keep an eye on my child. And then I got a call an hour later with a follow-up call saying, hey, how's your child doing? At that point, we'd moved on to another crisis. There was already something else. I was like, what are you even talking about? Oh, yeah, right. I know. As a parent, it's like, it feels like you should be on roller skates all the time.
Well, kids move fast. They do.
They do.
So do poisons, though. That's why you got to call right away if something's wrong. Can we talk about iron poisoning in children for a minute?
Sure.
What's that like when you get that call? So maybe a child has eaten any number of tablets because you don't know how many often are in the bottle to start with. How urgent is that? What signs do you look for? What's your experience with iron poisonings?
Well, I'm not the clinical person, so I can't really give you that insight that a poison specialist could give you. But in terms of iron poisoning and iron poisoning prevention, we know that prior to the opioid epidemic, the explosion of opioid poisonings, iron poisonings were the number one cause of fatal poisonings in children. And the reason was because you have multi-organ involvement basically everywhere throughout the body. It's not a single structure that's affected, that you saw essentially oxidation across organs. So as opposed to opioids, which of course we have a wonderful rapid-acting, antidote, naloxone, we don't have the same tools at our disposal for treating iron poisoning. And that was why we would see the fatalities. So in my poisoning display, I have a pill and candy display that is sealed in a box, so it's not accessible to children. One of the lookalikes I have is a little baking M&M, little green baking M&M, and then an iron ferrous sulfate tablet, because they're the same size, both green, attractive, small, probably sugar-coated. So you can see why a child would get into them, but the effects can be quite serious. This is also problematic for a family that has a toddler and the mom is pregnant again, right? She may be taking prenatal vitamins and you've got a toddler and she's busy. And I had terrible pregnancies, so I know that I was not on my game during pregnancy. So you can really see how a mistake could happen where a toddler got into those high iron products.
Yes, even the children's vitamins with iron right now, some of them are gummies. And if a child really likes how they taste, those child-proof products, as nice as they are, they delay a child getting in there. They're smart. They can get into stuff. And if they eat the whole bottle.
Yeah, vitamins are a consistently high source of calls to poison control for children. In general, I have seen that I haven't been able to find a gummy product for children with iron. So their solution, I'm sure they exist, but I haven't seen them commonly. So that's kind of the bad news, though, is that they've pulled the iron out of the product. Children do need iron, particularly children who are like my child. I have a vegetarian at home. So she really needs iron. But the fact is they've made the product so attractive to children, they've had to pull the iron out just to prevent poisonings. So yes, we routinely see poisonings of, from products that look like candy. Gummy bears is certainly one of them. And when you mentioned the child-resistant packaging, that's really important to understand for families, is that it is not child-proof at all. And in order to pass the test from the Consumer Product Safety Commission, the packaging is just meant to slow the child down 30 seconds. And then at a certain point during the testing, they'll tell the child they can use their teeth, at which point the child will pop it right off. So it really is not a child-proof product. One scenario we see that's pretty amazing is that parents, in a moment of being busy or in the car or whatever, will actually give the child the pill bottle as a rattle. very, very common. It rattles. It's a satisfying sound. And so parents will describe, well, I handed the child the bottle and I heard the rattle, 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 and then silence. And that's because the bottle's open. And so that is a very common scenario. It does make that sound, but it is not a safe rattle. So.
Right. Good point. Well made. Now, what are a couple of things that people can do other than keeping those medications out of sight and out of reach and not deliberately giving them to a child? What are a couple other things they could do to protect their children from getting into medications they shouldn't have?
Well, in general, with children, it's a lot about access, what you're bringing into the home. So when you bring the medicine into the home, you want to have a system in place for keeping it secure. I really like the lock boxes because that lockbox product, even though it is a little inconvenient, in the short term, you're getting really good habits in place for the child's whole life cycle. So what's a good product to keep, a way to keep medicine away from a toddler is not particularly useful for a teenager, right? So you're experiencing that, right? With your child. Now you have a child who's tall, who's very capable, who is still interested in medicine, right? And so I like a lockbox. Doesn't have to be super expensive, but that just gets you into the habit of putting medication that has a potential harm, and that would be anything for pain, anything for blood pressure, blood sugar, even cough syrups, powerful cough syrups, just in the lockbox. This also protects people from self-harm scenarios. And I think let's never forget 20% of deaths from poisonings are the result of self-harm. I think we talk a lot about prevention in children, and it's often prevention with accidents. I don't see any reason why we shouldn't also be protecting our children against intentional poisonings. Whether a child is struggling with depression or a terrible experience or a breakup with a partner, etc. In that moment of panic, if things are accessible, you can see a tragedy. So I like the lockbox. And one parent can be the responsible party with the code, and it's just a good practice to get into from the beginning.
When you say a lockbox, are you talking about any old toolbox that you can put a lock on, or is there a certain product that you recommend?
I don't make particular recommendation. A toolbox can be fine. There are products that are sold medication lockboxes for that purpose. So I have one that's handy, and it fits actually in a drawer. It's low. We don't have all that many medications in our home, although as I'm getting older, I feel like there are more and more.
I feel you.
I may need a bigger lockbox at some point. This one fits in the drawer, and it's very easy. Obviously, you could carry away the box and use a hammer or something probably to get open, but it's really, you don't have to, it's not like you're securing jewels. It's really to slow someone down, for that child or even for that teen who has a self-harm impulse. We've seen some research that says if you can just slow them down a few minutes, that impulse for self-harm or that curious impulse will pass. So it doesn't have to be, a safe for money or other things like that. It can really just be to slow the person down. So yes, a normal toolbox would work, anything with a lock on it. There's another thing too in terms of prevention that I wanted to mention, and this is for all ages also, just like the lockbox is actually for all ages. The other piece is drug disposal. Not stockpiling. And so we understand, I talk to people all the time who are like, well, I might need it, and there might be a hurricane here in Florida. We have to deal with, storms, et cetera, where we might not be able to access our medicines. And so in their mind, that's a practical thing, is to just stockpile everything you've ever had from the pharmacy. And we know that's not great, obviously. So these medicines are expired. It's not clear who they were for, what they were for. People don't recall them. And now no one's assessing whether that medicine interacts with current medications, et cetera. So there's been an increased effort around the country for local sheriff's departments, law enforcement, et cetera, to offer drug disposal. You don't need to involve local, sheriff's offices, et cetera. You can dispose of them yourself. The way that you can do that, there's some guidance out of EPA, where you basically take a Ziploc bag, you empty your pill bottles into them, and you spoil the medication. And I've seen kitty litter suggested. I've seen coffee grounds suggested. Some way to spoil that medication so someone can't abuse it or get into it, and then put it out with your regular trash. So if it's just a few bottles, that's one way to get it out. If you have a lot, though, a drug disposal program would be useful. And so, don't keep those things. It's almost like little time bombs in the home. That old bottle of hydrocodone or something that you had from the dentist ages ago. Well, is it really sitting there available to a teen? Is it sitting there available to someone who's lost a job? Like, just get rid of it. It's dangerous, and you may have completely forgotten about it. So, just doing routine sweeps and making sure you're not accumulating a lot of dangerous and unnecessary medications in the home is a really important thing for prevention.
I am a big fan of drug take-back days twice a year. Do you have those there in the Miami area?
We do. So those are the ones that are sponsored by the DEA, right? Those are the ones sponsored and paid for to, I think supported in some way by the federal government. But there's also local initiatives. They can have names like Operation Medicine Cabinet and Operation Clean Sweep. And in Broward County here in South Florida, they pair it with a shred-a-thon. So people can bring their old medication and their old paperwork and dispose of everything, and that protects them against poisoning, drug diversion, and identity theft. So I thought that was a nice pairing. Yeah.
Love it. That's great. We have drug take-back days up here in Ohio, of course. They're very popular. They do them twice a year. It's usually in April and October.
Yes.
And I'm so glad that you mentioned that, because not having the drugs there eliminates the opportunity for a poisoning. Dr. Stephan, I'm in Ohio. What happens if I dial the number here in my home state?
So as I mentioned, we have 55 poison control centers around the country. And in your state, you are served by 2 different poison centers. So depending on where you live in the state, there are service populations for each poison center. And now these days, we're also seeing some geographic information system routed calls. And so we've seen an improvement of that in just the last year, where some of our services like Siri or Alexa or iPhone, et cetera, are now routing calls geographically. So even if maybe you're out of town, but you're nearer to your other poison center, you would then might be routed to that other poison center. So the 2 poison centers in Ohio that may be serving you would be the Cincinnati Drug and Poison Information Center. That's based at Cincinnati Children's Hospital. Or you might speak to the Central Ohio Poison Center in Columbus, which is based at Nationwide Children's. So those are the resources for your state, but every state has some constellation of poison control center service, and it might be, the bigger states have multiple poison centers like we do in Florida, but for our more rural states or sparsely populated states, they might actually be served by one poison center serving multiple states.
Interesting. Yes, we have 50 states, but we have multiple territories. It's interesting how they cooperate to serve one another. That's great.
It didn't used to be that way. So before we had a national number, it really was very piecemeal. And so you would see there were situations where funding would threaten a poison control center in a certain area. And suddenly that area went dark in terms of the information we're gathering about what poisonings are happening in the community. And so from a public health perspective, they saw the strength of a uniform national network, and all of our data gets fed into something called the National Poison Data System, and it is in near real time. So this has been very useful for detecting the types of trends I mentioned with the COVID-19 related poisonings, right? We were able to see that very rapidly from poison center data, but also detecting things like contaminated products, street drugs, confusing packaging on new products, et cetera. We're able to provide that information to the local health departments, but also CDC, so they can rapidly assess and respond to public health threats related to poison.
Very good. Now, since you are an epidemiologist and you're not at the call center taking the calls, how does someone get in touch with you if they need education provided?
every poison control center, I believe, in the country has an educator who does basically what I do. So in addition to responding to poisonings, we're also charged with providing prevention education. So you can contact your local poison center, but for Florida, we're here. You can reach us through Poison Center at fpicn.org. So that is, that comes straight to the educators in the state of Florida. And then we respond to people and make arrangements for different educational programs. For ordering materials, you can actually order them directly through the hotline. And again, that's 1-800-222-1222.
Very good. It sounds like if there were, for example, a group of grandparents raising grandchildren and they feel like they themselves had an experience and they want to kind of warn their friends, but they don't want to do it themselves because they don't feel empowered to spread the message, and they want to invite you. I think that the information you just gave would lead them right to getting in touch with you so you could spread those important messages, show up and, educate them. That's awesome.
Yep. And the most important way to make sure that people know about what's going on in terms of exposures is to call the poison center and place, basically a case report. So sometimes people will call and, okay, maybe the poisoning happened a few days ago and the person has survived, but you still want somebody to know that, hey, that package was really confusing. Like, for instance, there was an inhaler product that came out years ago that had a capsule, and the instructions just weren't clear. So people opened up the product, swallowed the capsule, and then thought, well, wait a minute, what's this thing for? And so we had hundreds of those cases in the first few days, but we were able to immediately detect them, respond, and get the package reconfigured. So those are examples. So if people feel that there has been a poisoning or a dangerous product, feel free to call it in and essentially put that into the National Poison Data System as a record, and that will help strengthen public health response and get those dangerous products off the market. So for instance, with the Evapi or Evali, we had here, remember in the old days when we had the previous public health crisis was the vaping related lung injury. Remember that? So some of that early data came from poison centers. And so they were saying, this person just says they used an e-cigarette, but their lungs just look terrible. And we don't, this is not typical what we would expect for a young person with such extreme lung disease. So, feel free to place reports about things that have happened in addition to seeking immediate care.
I like that you touched on that medication that didn't have super clear direction. It brings up the topic of the ISMP, the Institutes for Safe Medication Practices. Are you familiar with them?
I've heard of them. I don't work closely with them.
They get the word out about near misses and medication-related misadventures. I think it's great to reach people from a lot of different angles so then there's as much coverage of a problem as possible. Yeah, you can't go wrong when you're shedding light on something that's that serious of a problem.
Of course, and the FDA also has an adverse reactions hotline that people can submit, directly to the FDA, which I've done in the past for our own experiences with certain products. That's also very important, but Poison Center data is just one of the resources available.
Even though a potential poisoning is an emergency, could someone with an urgent poisoning concern use a website instead?
So there are different tools that people use. At our Poison Center, our directors still feel very strongly that there is a benefit to speaking to someone directly. So around the country, there are different options. So for instance, I know North Carolina and Georgia's Poison Centers do offer chat with their poison specialists. There are also two websites. One is poisonhelp.org, and that is basically a triage type tool that people can use if they prefer to begin with a website. If it starts to look like a complex situation, they are going to be referred back to speak to one of the poison specialists. So there's another one also called Web Poison Control, which is quite rigorous in terms of the information that you can be provided about the substance. That being said, because this is a program about the voice, there is so much that we can hear in a call that goes beyond what you can understand or glean from a text or a chat. And certainly if it's a website, we're not present to assist. So for instance, we might speak to a caller who is describing an incident or a poisoning, and if we're hearing that their voice is slurring, we know that they are impaired. They might not notice it, but we can hear that. So for instance, a child calls or a parent calls about a child and they say, my child grabbed the baby powder while they were on the diaper table and whatever, and we hear the child coughing in the background. We know that that child is in danger because actually baby powder inhaled can be quite a substantial risk for a child. So there is diagnostic information that comes through the phone. That being said, we need to reach people where they are. So it is good that people have options. So for people who, for instance, are hearing impaired, they're going to want to have other tools at their disposal, and that's where the chat or the text comes in. But the websites we really consider those sort of pre-triage because there's a limit to how much you can learn on your own. As we're finding these days, it was interesting with COVID. I was actually on the hotline myself, on the COVID-19 hotline, because it's not a clinical service. It was more of an epidemiologic or public health service. So I was helping people, and over, people just wanted to talk to someone. So I think there's definitely a role for that human contact and reassurance. People were just saying over and over, "Oh, well, who are you, and what do you do?" And and thank you for being honest. And just, because at that time, especially, we had so little information that we just had to tell them, "I'm so sorry that there's not more we can tell you right now." But it was important for us to be making that comment, that their comments or that connection with people, they were reaching out for that. So there's still a role for the voice and person-to-person contact that way.
Great comment. A lot of people go out and try to find their own answers. I love it when they go to a reputable source.
Yeah, well, I think we all use all the tools available to us. Like, I don't agree with people who say, well, don't tell people not to use Dr. Google. I mean, come on. We're all going to reach out to resources available to us, and certainly the internet is one of them. But for emergency health matters, I think it's best to talk to someone with a lot of expertise so you don't lose time. And then for emotional or social things, I still think that we do need to interact with real people. That can be the best medicine.
Talking about interacting, what's a typical week like for you? Are you interacting face-to-face with people? I know it's these strange COVID times, but prior to COVID, what was a week like for you? Can you remember?
So, exactly, right. It's back into the pre-pandemic days. Yeah. So in that setting, we did a lot of public events. So probably say 7 to 10 a month. So just like you were describing, we were at health fairs, public events, trainings. Some of that training was remote. Some was here in the Poison Control Center. So, behind me, you see our classroom. So we had on-site trainings routinely, and I enjoyed that because I could show people the tour of the center and the call center, so they could see, we're real people. It's not a call center, in a foreign land, somewhere far away. It's like right here in your community, your neighbors answering these phones. So that I really liked that piece, so they could see who we are. Particularly for our EMS providers, I really liked that we could bring in our paramedic crews, our fire rescue groups, because they work with us so commonly, and really having a relationship, a face-to-face relationship and a relationship of trust is so important for that community. Particularly, I feel like also with our healthcare providers, that's especially important. So then going out into the community, sometimes schools, often in spring, when they have their health and safety events, career days, those type of things have been fairly common. And then working with my colleagues from my office in terms of material development and messaging, mass media development. We have the opportunity from time to time with grant money to do a billboard campaign or a radio interview, and those are also wonderful ways of getting the word out. So it's a lot of variety, which I love. So after a few days in the office, I'm like ready to be out there in the community again. But after a few days of being out at health fairs and being hot and sweaty and talking for 4 hours, I'm ready to be back in the office.
Do you like that variety of doing a little bit of this, a little bit of that out in the community, in the office, radio interview here and whatnot? Is that something that appeals to you?
Oh yeah, no, it's great. It's useful too that I'm always learning. I think there's working with different audiences is very stimulating. I feel like sometimes, working with the older adults, and then the next day I'm talking to healthcare providers. I'm using a whole separate set of, vocabulary. The questions are so different. Although I have to say, one common thread across populations is the issue of health literacy. And we hadn't really talked about that, but I've really found that everyone likes simple. And so I've really sort of tried to move away from a lot of the jargon and the medical language that was appealing to me when I first started this role. It's exciting to be able to use the language and the fancy, the big words, et cetera. But in doing education and outreach, everyone likes simple. So, for instance, I developed a tool, a game. Really, it's like it's called my Cookie Jar of Doom. And it is actually a cookie jar shaped like a skull. And in it are the 12 most deadly poisons in Florida. So I designed it for high school students. I asked them, what do you think the 12 most deadly poisons in Florida are? And we have a conversation about what they think is in the jar. And then we start pulling them out, or they pull them out, et cetera. And it turned out to work just as well in the EDs with doctors. I think there are certain things that are just human. That stories and games and interacting with things physically, et cetera, are fun. They're fun for everybody. So fun is good. Variety is good. And I love that in this field, things change. I sort of jokingly call it the flavor of the month, because it'll be the cinnamon challenge, but then it'll be, fish poisoning, and then it'll be a new jellyfish, and then it'll be, hurricane poisonings with carbon monoxide. And so there's a lot of variety, and it keeps me on my toes.
Since you brought it up, what are the most common 12 poisons in Florida?
So a few years ago, I got data, really nice granular data from the injury prevention program at the Department of Health in Florida. And so they were able to actually give me information about the substances that were leading to the most deaths. And so it was a few years old, that data, but it was really interesting. And so for the cases where they had specific substances identified, which is not all of them, of course, we have some that are not coded, but for the data that was available, I was able to sort of rank them. And when people play this game, they generally think, like I said, snakes. People are scared of them, right? So that they think that will translate into being a substantial cause of death, actually. So no snakes in the jar, no spiders in the jar, and I always joke, there's nothing alive in the jar. It's okay. So when they do reach in and they pull out items, some of the ones that they'll find. So, for instance, first of all, is a little vial that appears to be empty, but it's carbon monoxide. So carbon monoxide is one of the leading killers in Florida for poisoning, particularly after storms, when people are running their portable generators, their portable gasoline power generators, I should say, and they're running them too close to the home or in a garage or in a space, and they just don't have a sense that that's dangerous. So carbon monoxide is a consistently high cause of poison deaths. But during the period that I got the data for at that time, it was also oxycodone, hydrocodone, methadone, and then heroin. And so I lay those out when, and they'll see that there are 3 prescription bottles and then there's an illicit drug. And it's an opportunity for me to talk, to our high school students and adults in general about that these things chemically are the same. So they're all in the same family. They act the same way. And then, so I said, well, what's the problem with these substances? And people generally will know, okay, there's a problem with overdose and a problem with addiction. So it's a door that we can talk about addiction. And so when I put all my 12 most deadly poisons out, they see that the majority of them actually are in a prescription pill bottle. And that opens people's eyes. And I think that's the message that people haven't yet gotten, is that the reason that certain medicines are in those special bottles is because there is additional risk associated with those medicines. And I think people tend to be binary thinkers. Things are good for you or they're bad for you. They're healthy or they're unhealthy. And medication, as pharmacists know better than anyone, is not you can't really assess it that way. It's going to be good for you, this person at this dose, over this time. And so this is a message that I'm trying to, remind people, even if it is an antidepressant, there's the risk for overdose. If it's someone else's medicine, there could be a problem with allergy or a drug interaction. And so it's just a visual way of helping people see that. So cocaine is also in that jar. So cocaine and heroin are our two illicit drugs that have been consistently high causes of injury, death from poisoning. And we talk about sort of how those drugs actually kill, which people are quite interested in, and they don't really understand like physiologically what goes on, with a depressant killing versus a stimulant. So that's an interesting topic as well.
That covers all 12 then?
Almost. I left off the benzodiazepines, which I really shouldn't have, because actually benzos are our number one substance in terms of calls to poison centers. So just over the last few years, we have some data available on our website under the poisoning data tab. It's a nice interactive dashboard. And so our top substance for the state of Florida for the last, I believe it's a 3 or a 4 year window, is in fact the benzodiazepines. So I think people don't realize that there's the potential for these medicines that are supposed to relax you, which sounds like a positive thing, where there is the potential for harm, particularly when combined, with an opioid, with alcohol. It's just not necessarily on people's radar that this positive thing can turn deadly.
What's the scariest poison that you've heard of?
I get asked that question from time to time, and what people are generally expecting is something really exotic and unusual. So like an industrial chemical or a gas or whatever. But the answer, just from all of my years of experience and looking at data and hearing about fatal cases, is actually alcohol. And what's so interesting about it is that alcohol changes our behavior and changes our judgment fundamentally. So not many poisons will do that. We also have this strange social relationship with alcohol, where we are encouraged to drink it, where we accept drinking it, where we actually equate drinking it with being happy and celebrating and partying. And so there's this sort of rosy glow around alcohol, at the same time as we know in the data that it is commonly a very serious cause of injury death, whether the injury is actually a poisoning, an alcohol poisoning, or whether that alcohol led to a car crash, or that alcohol led to a fatal interaction with a weapon, whether the alcohol led to self-harm. So to me, it's kind of the most stealth poison, in the sense that people engage with it very young, very casually, and the outcomes from the public health side are bleak. So 25% of the deaths the year that I really got my hands on good data for Florida, 25% of the deaths had alcohol present. It wasn't necessarily the only thing involved. It was mixed with medications and other things, but it was a substantial factor in people dying from poisoning. So alcohol scares me. I tell this story to kids about here in Florida. We know not to swim in canals, because the big teeth, right? So we have gators. We do not swim in lakes. We do not sing. But, we had a story down in Coral Gables where 2 young people had been drinking and they went swimming in a canal and encountered a crocodile. We all know not to do that, right? But the alcohol being present changed their judgment and put them at serious risk. So, those are scary stories. And, it could also be changing your judgment, and you're getting in a car with someone you don't know well, or you're getting in a fight with a dear friend. All of these scenarios that can lead to injuries. So poisoning from alcohol is a big one for me.
Thanks for sharing that. That was not even on my radar. Wow.
That's the problem. Alcohol, I feel like, flies under a lot of people's radar. Also clinicians, because treating acute alcohol intoxication is actually quite complex. And so, our directors give programs on treating, people who have either used alcohol intensively over years. So people who have a history of alcoholism, as opposed to also just people who are acutely intoxicated in one sitting.
Yes, the old 21st birthday, right? Yeah.
Yeah, and for young people, for our teens, it's actually physiological. So we develop an alcohol dehydrogenase in our liver in our late teens. It's actually a physiologic change that we've developed probably over thousands of years of drinking alcohol to help our bodies excrete it effectively. So when we see fatalities in young teens, it's usually that their just bodies couldn't excrete it at the same rate that the adults are able to do. But that being said, our peak deaths for alcohol intoxication, for actual alcohol poisoning, are men in their 30s. Again, doesn't seem to be on people's radar the way I would think it should be.
Well, I'm going to change subjects so my listeners don't think I'm deliberately relating alcohol to my next topic here.
Okay.
How can someone prevent a poisoning, just in general?
Right. So, in general, it's awareness of different poison hazards in the home. So, the potential for a medication mistake, the potential for a household product exposure, just understanding, looking closely at labels. I know that, the warnings that come on our medications are in very tiny type, but having a grasp that anything that is a prescription medication, by definition, there is a higher risk than something you purchase over the counter. And having them stored in a place where you have control over who's using those products. So in general, we say up and away. That's the name of the campaign from the CDC that's focused on medication and children, but it's really a good practice across the board. So we talk about storing medications above the shoulder height. So that's an upper cabinet with a closed door. So that means it's not visible, right? It's not attractive to children, and it's out of reach of children. We don't emphasize locks as much as we used to because we found that locks were giving people a false sense of security. So up and away. So that means that a drawer is not a good place to store poisons. A shelf is not a good place to store poisons, right? Both of those are either visible or accessible. So that's just general guidance across the board. And then, of course, knowing what to do if something happens. So that way you're preventing as much as possible, but you also have the poison control number handy to respond right away for adults as well as children, particularly adult medication mistakes. I feel that we are underutilized in this area. Too many people sort of wait and see, or they're alone. There's no one to get help when they, start having trouble. So we want people to call right away, even for questions. It's an opportunity for us to educate.
Those are all great points. And you brought up a couple of great ones earlier, too, about the type of cap that's on the products.
Yep.
And the pretty poisons concept, too, the look-alike items.
Yep. We actually have a special designation, a checkbox in our system for lookalike poisons and for particular scenarios. So container confusion is another, where someone has recycled a food container for something toxic. Another really common thing that people do just in that moment, where it just is easy to use that Gatorade bottle for that leftover, antifreeze or whatever it is, and it still remains an attractive visual for a child or an adult. Again, back to the older adults. That's a scenario that can really trip up anybody.
Wow, great points. Well, as we wrap this up, I'm going to ask you a couple of, what do you love most? What are your biggest challenge type questions? So first, what do you love most about working for the Florida Poison Information Center?
Well, I have great colleagues. And that's true locally here. The poison specialists are tremendous. I admire the work that they do so much. I mean, they are literally, lifesavers, and they are talking to people in a terrifying moment, and they are the voice of reason and calm. And that's actually one of the most common things that I hear in our quality assurance calls. When we talk to callers, they say, "Oh, she calmed me down. Oh, she made me feel so much better." And so the power of the voice is really there. So I admire that work that they do so much. So they're tremendous. I always have a lot of confidence in directing people to them. And also my colleagues around the state and around the country who do this work. We're a really passionate group. We all love public health. A few years ago, we went together to the Public Health Museum at the CDC, and we just came out feeling, like that we were shoulder to shoulder with people working on different health fields, different health problems around the country, and that we were part of a long tradition, and that was pretty cool. And then just I love being out in the community. I have learned so much from the residents of South Florida. They never cease to impress me with their dedication to loving and caring for their families, for their community members. I am welcomed with hugs. I enjoy it so much. People are so appreciative. And I try to go places that no one has been before from my group. No one has reached with our information. And I just love being the first of my group to be in a community. And it's been a gift really in so many ways.
That's just beautiful. What is one of the biggest challenges you face?
Well, we are a fairly small, nonprofit. Actually, we're supported by the Department of Health here in Florida. Different poison centers have different structures, and so, we have to be really efficient about what we're doing. We don't have a big advertising budget, so we work through our safety educators. And so the challenge, like we talked about earlier, is really getting people's attention, letting them know that we're there. And so that is I've welcomed the attention that we've gotten during this pandemic in terms of we have gotten more attention because of the cleaning exposures. There's been more media coverage of poison control and that we're there to help, et cetera. So that's been good. But in general, that is the number one thing. In injury prevention, generally, there is a huge barrier, and it is the sense that this will never happen to me. And so there are many teachable moments that can occur when there's been an injury. So when someone's in the hospital with an injury, that could be utilized to sort of say, how can we prevent injuries in the future? So there's a hospital-based injury prevention program that I think is very valuable. I'd like to see that expanded. But using sort of education in a compassionate way, with a lot of humility and understanding this can happen to anyone. I think that's helpful in meeting that challenge because no one wants to hear about these stories. I'm injury prevention is like a Debbie Downer topic, so
I hear you.
We have to make it exciting.
Right. Well, when you relate it to real people and real things that have really happened, people start to use their imagination. How could this happen to me? Yeah. Now, here's a story from me. I'll keep it brief. I have a 17-year-old son with autism, and he also has an eating disorder called pica, and he eats non-food items. It's something that not everybody knows about. He ate part of a poinsettia at Christmas time, and that's a classic example of that is a poisoning. You need to call a poison control center. He was at Grandma and Grandpa's house. We were having our Christmas gathering, and I look over and he's eaten part of a poinsettia. My mother-in-law saw it happen, and she's like, "Is that okay?" And I said, "No." I was one of those people who had to call poison control, the poison helpline, even though I have given talks myself. I could not prevent my son's own potential poisoning. I called. They talked me down like you talked about, and they told me that he's going to be okay. This is what you do. And they did call me later to make sure that he was okay. I think it was an overnight thing where they called me the next day. He was just fine. He didn't vomit. I don't think he had diarrhea. Sorry to get too personal, too much information. But honest to God, I had to call myself because these things just happen. And if we don't talk about it, other people won't realize it could happen to me too.
Oh, absolutely. And like I said, telling those stories from my own family. And unfortunately, they just keep coming. I mean, I'd love to say that, this couldn't happen, but we just recently had an issue where, my child had a cough and, she's also, older teenager, had a cough, and I gave her a cough medicine and then went, wait a minute, I don't even know whether that cough medicine is appropriate with her prescription medications. And it turned out not to be. So I had already, so someone with so much background, years of experience, just in that moment, I was focused on her cough and helping her sleep. And it just, we give the medication in the morning. It was hours and hours ago. So these things, like you said, really you never outgrow, and it's not a function of your knowledge. You just have to be able to react when it happens. So yeah. And just one important note about calling the Poison Control Center for a situation maybe that's embarrassing or frightening, calls are confidential. And I do think that's important that people understand we are HIPAA compliant. your pharmacists, of course, will understand what that means. So we are HIPAA compliant. We are not releasing information to Child Protective Services or police, et cetera. There's an extremely high standard for releasing that information, and we've never released it that I know of at our poison center since I've been here. So families who need to call several times because they have a child, for instance, with autism, that is absolutely fine. It is not going to put you on the list of bad parents somewhere. People really believe, they're like, I'm sure I'm on a list. And it's like, please call us as many times as you need us. That is actually our function. And we do also have people who call us because they are struggling with paranoia associated with mental illness. And that's something I don't think a lot of people realize at Poison Control. Poisoning is one of those things that is really sort of triggering for people who struggle with paranoia. Or anxiety, or OCD, for instance, obsessive compulsive disorder. So we do receive calls from people who are dealing with those conditions, and we are tremendously useful for them because if they didn't have poison control centers to talk to, in many cases, they may end up in an emergency department. So it's serving that purpose as well. So feel free to call us. We have frequent flyers, and we understand those conditions.
That's a great point. I never would have even thought about how you're kind of triaging people who have mental illness. That's important. And thank you for saying that poison control centers don't judge. I never felt judged. Just for anybody listening to this who has never called, in that moment, you're thinking about your child. And when you bring that up about the Child Protective Services, that thought never even entered my mind, not even until you said it. And this was years ago. Yep. And when you are focused on your child and helping your child, that's the best thing to focus on. Yes. And thank you for reassuring me, though.
But I do know, and I think people should recognize that in minority communities, for instance, that is a huge consideration. So I spoke to a colleague of mine in New York City, and she said that about a quarter of the families in New York City have had contact with Child Protective Services or in some way. So if you're living in a community where you know someone who has had a child removed, or there's been an investigation or whatever, your love for your child, you would have so much fear about that child being removed. And so we just want people to understand it's an understandable fear, but please do not worry about that. We are not in this situation. Because even if there is something that to us looks like, an abuse scenario, we would want that to be assessed by people who know what they're doing, and that would be in an ED setting, in a face-to-face setting. So we're not in that setting at all. We're not judging.
Good. Well, thank you. That's so important. Well, as we wrap this up, I'm going to ask you, is there anything else you'd like to talk about before we end the interview?
Well, as an epidemiologist, that is my training. I also have that background in public health, but I feel like now more than ever, it's important to be using data and an understanding of what's happening, what the big picture is happening, so that we can orient our resources and our time to the most important and serious problems. So that's why, when I go out and I do my education, I am really focused on medicine safety. And I talk about alcohol and I talk about self-harm because that's where the data is telling me if we want to save lives, we have to talk about this. In Florida, we have very, very low numbers of child deaths from poisoning. This is wonderful. But it also means I can't be out there only talking about child safety because the potential lives I save are very small. We're going to keep doing that work, but I can't be single-minded about that. So epidemiology drives effective interventions, and that's why you're seeing the sort of struggle to get out the good data on COVID right now, but even for injury. Having the data and local data versus state data versus national data is going to be so important. So that's the work public health epidemiologists do, and it's the basis for the actions we take.
Can you recommend what pharmacists can do in their communities to help with this?
Oh, pharmacists have a tremendously important role to play because people are coming to you and trust you and have a relationship with you in terms of the medications they're choosing, even over-counter medicines, not just the prescription medications, but you're already a trusted, known factor. And so, they're going to come to you, and we're there to basically back you up. So in terms of community outreach, again, the schools, the teachers, you have an in where we don't necessarily have relationships. So we know a lot of pharmacists and also nurses and doctors who will go into schools and do education for their children's classrooms, at the local health fair, speak out on issues, provide interviews, et cetera, and promote the hotline for poison control as part of that outreach. So it's a wonderful opportunity to share your expertise and to provide a resource that will be available to them going forward 24 hours, 7 days a week.
Thank you so much for being my guest on the Pharmacist Voice podcast, Dr. Wendy Stephan. I hope you have a great summer.
Thank you so much. I appreciate the opportunity.
I learned so much during that interview. Poisoning prevention is a very important topic. Even though I have experience as a volunteer with poisoning prevention education, I learned things today that will help me help others in the future. Thank you for joining me for episode 27 of the Pharmacist Voice podcast. Visit thepharmacistvoice.com to subscribe and read the show notes. That's thepharmacist, with an S, voice.com.